Thank you so much for that very kind introduction. You know, I realize that many of you have been sitting in the dark for a very long time. So if you will indulge me, I'm going to ask you for a favor. Could everyone just stand up for a moment? All right, now a big stretch, 2 arms above the head. And on the count of 3, I want everyone to yell as loudly as they can, NACCHO. 1, 2, 3. NACCHO! There we go. Okay, you feel more awake, everyone? Okay, great. Have a seat, please. Well, I want to thank Dr. Hasbrook and Dr. Jett for having me here. I want to thank the leadership of NACCHO as well, the board, the staff, those who helped put this event together, for inviting me. And most importantly, I want to thank all of you for the extraordinarily important work that you do each and every day to protect and to build up public health in communities all across the country. I know that many of you are often asked to do more and more with less and less. I know that for some of you, there may be times where you wonder if you're really making the full impact that you really want to make in your communities because of how much is actually on your plate. But I want you to know that the public health of America could not and would not improve without your leadership. And that is because the most important determinants of health are where all of you are. They're in our communities. And it's really leaders like you that help shape not only policy, but also the environment and the culture in communities which ultimately impact health. Now, I learned about the importance of communities in impacting health when I was very young, actually when I was just a boy. And I learned about it through my parents. My parents came to the United States when I was just 3 years old. They settled in Miami, Florida. My father is a family physician. My mother didn't have a degree in medicine, but she helped to build a medical practice with my father and took care of patients over many years. And as a kid, I spent a lot of time in that clinic, seeing patients come looking stressed and worried and ill, and leave looking more relieved and knowing that there was somebody who was going to be with them as a partner in their healing. And I was excited to see that as a child. But what I also realized is that through my parents, I realized that medicine was a lot more than just about diagnoses and treatments. I realized that it was also about building a relationship with patients, one that was based on trust. But it was also about understanding where patients came from and about meeting them where they were. My parents knew that even though they couldn't write prescriptions for stronger relationships in a patient's life, even though they couldn't write a script for changing the environment that someone went home to, they knew that relationships and the environment in a community had a major impact on the health problems that they were seeing in their clinic. Now, through these experiences as a child, I not only learned from my parents, but I was also inspired to go into medicine. And through college and through later years in medical school and residency training, I thought about those experiences as a child, and I was very eager to get started in actually practicing medicine. And once I did start practicing medicine, it was a great experience. I found I loved it. I loved building relationships with patients. I loved thinking about the science of medicine. But I also realized that so much of what I was seeing every day, in terms of the conditions that patients came in with, were actually preventable. And that was very disturbing to me. And I was reminded of what I learned early on as a boy from my parents, that the real determinants of health are actually not in the hospitals and in the clinics, but they're out in the communities where all of you are leading and helping to shape public health. Now, over time, I came to see this more and more in my patients, but I also realized a second thing, which is that I wasn't necessarily trained or equipped with the tools to actually change those determinants of health in communities. And that was very disturbing to me. I realized that it was actually the safety and the layout of neighborhoods which had a much bigger impact on whether a patient was physically active than what I told them in clinic. I realized very often that it was whether or not someone had access to affordable, fresh fruits and vegetables that ended up making a bigger difference in their diet than what I mentioned during the last 3 minutes of a clinic visit. And I also realized that the culture that many patients grew up in, the culture that shaped how they thought about emotional being and mental health, impacted whether or not they were willing to come forward and seek help when they had mental illness. So these are important realizations to me, and I know that these are not new realizations to all of you. As you know, as a country, we invest far more in treatment than we do in prevention, and our failure to invest in prevention is literally killing us, and that's something that we have to change, and with your help, I think that we can do that. So what all of us are really called to do now is to build a culture of prevention in America. And what does this look like? Well, it looks like in America where physical activity is truly accessible in the form of sidewalks, in the form of bike paths, in the form of safe neighborhoods. It looks like in America where people can purchase affordable fruits and vegetables without having to drive 30 miles. It looks like in America where we decide once and for all that we are going to cast aside the unacceptable stigma that's still associated with mental illness, that still prevents too many people from coming forth and getting the help that they need. And it looks like in America where we say that violence, whether it impacts men, women, or children, is unacceptable, full stop, with no exceptions. That's what an America that's based in a culture of prevention looks like. Now, over the last few months as Surgeon General, I've been traveling across America, from small towns to big cities, hearing directly from people about the challenges that they're facing. And what I've been hearing about are certainly challenges and problems that are familiar to all of you, but I've also been hearing about ideas and innovations that people are building on the ground, innovations which are moving us slowly but surely closer to this culture of prevention in America. In Richmond, Virginia, when I visited a few months ago, I heard about the Family Fatherhood Initiative, where the health department is collaborating with faith leaders and with the juvenile justice system to create stronger fathers and stronger families, recognizing that this has a direct impact on the health of husbands, wives, and children. In Columbus, Ohio, I learned about a community health worker model that is bringing care, including preventive care, to people in remote parts of Appalachia, people who would otherwise have a very difficult time getting to see a doctor or a nurse. In Indian River County, Florida, one city with a high proportion of residents who live below the poverty line made a decision to transform what was a very unwalkable community into a community that had sidewalks, bike paths, and better lit areas, as well as parks. And what they found is that following their changes, 95% of the residents noted an increase in physical activity, which they attributed to better lighting and to more spaces for physical activity. In Orlando, where I was a few months ago, the city has actually built a very interesting collaboration between behavioral health practitioners and the prison system to enable residents to get mental health screening at the beginning of their sentences so they can get connected to mental health services early rather than later. And in San Francisco, middle schools have found that including a simple meditation exercise for students called Quiet Time has resulted in dramatic improvements in school attendance, in grade point averages, in teacher satisfaction, and in student happiness scores, all with a simple investment in emotional well-being. So these are extraordinary stories, but the tip of the iceberg in terms of what is happening all over the country. Now, during my time as Surgeon General, there are two themes that will guide me, two themes that I hope to work on together with all of you. The first is around building a culture of prevention in America, and the second is around health equity. I know that both of these values, both of these themes are very important to NACCHO, and that they are at the heart of so much of the work that you have taken upon yourself as an organization. And I want you to know that these themes will guide me over the next few years, and will run through each of the 6 action areas that I have laid out to pursue as Surgeon General. The first action area is around physical activity. Later this year, we will be releasing a call to action from the Surgeon General's office on walking and walkable communities. Recognizing that walking or wheelchair rolling is one of the best things that we can do to reduce and manage chronic diseases, recognizing that it can improve mental function and emotional well-being, we are putting forth this call to action to serve as a foundation for building a movement around walking in America. But this call to action will also call attention to the fact that not all communities in America are walkable. And it will push us to take action to ensure that everybody has the same chance to walk, to be physically active, and to reduce their risk of chronic disease as anyone else in the country. The second action area that we will undertake is around nutrition, where I will seek to call attention to added sugar, which has become alarmingly prevalent in our foods and beverages, and which is contributing significantly to our obesity epidemic in America. Our third action area will be mental health, where we will focus on reducing the unacceptable stigma that's still too often associated with mental illness. We will be working with faith leaders in this initiative to start conversations with their congregants and with communities all across America so that we can make it easier for people to talk about an illness that will affect, at some point or another, nearly 50% of Americans at some point in their life. Our fourth action area is tobacco. And here we will be working to expand tobacco-free public spaces. And when I say tobacco, I include traditional cigarettes, chewing tobacco, as well as electronic cigarettes or e-cigarettes. I should tell you that when I was on a trip recently, I had in the listening session that we were doing, I had a teacher in the audience who raised her hand at one point and said to me, "Dr. Murthy, my kids are not allowed to chew gum in class, but they are smoking e-cigarettes in the classroom. And they're doing so because we don't have rules. And we don't have rules because the city doesn't have rules. The city doesn't have rules because nobody seems to know what to do." So this is a problem that many people across America, young and old, are facing. Policymakers, teachers, doctors, nurses, and so many. And this is an area where we will focus on in terms of bringing clarity around what the science shows, around what we do not yet know, but which we need to clarify through research and through discovery. But despite the questions that still need to be answered about potential harms and benefits, there are two things that are still clear to me. One is that there is no reason that we should be exposing children to the potentially harmful nicotine vapors and potential other contents of e-cigarettes. And the second is that, and I should say about the kids, just parenthetically, while there are still unanswered questions, we do know that kids who smoke e-cigarettes compared to non-users are more than twice as likely to be open to smoking traditional cigarettes. And that concerns me, especially when we think about the risk of changing norms and normalizing cigarette smoking, something that we've worked so hard to change over decades in public health. But the second thing that is clear to me is that we should be including e-cigarettes in our clean air laws to protect kids, to protect pregnant mothers, and to protect non-smokers. Our fifth action area is around something you just heard about a little while ago, which is prescription opiate abuse, a crisis which is destroying thousands of lives in small towns and in big cities all across America. Our focus will be on working with healthcare providers to rein in the rapid rise of opiate prescriptions, but also to ensure that we are connecting people with evidence-based treatment. And sixth, we will be working on reducing violence, particularly violence against women, recognizing that to truly eradicate violence, we don't only need stronger laws and better mental health services, but we also need to shift how we relate to each other. Because I believe that when we see other people as anything less worthy than ourselves, when we perceive other people's lives to be less valuable than our own, that makes it easier for us to harm them. It provides a foundation for violence. And that's why addressing racism and gender bias is not just a social issue, but it is also a public health issue, and one that we must address collectively. Now, in each of these 6 areas, and in certainly others that I have not listed, we will need your leadership and your partnership. When it comes to shaping the built environment to encourage physical activity, to promote access to healthy foods, and to increase access to tobacco-free public spaces, many of you in this room I know have been leaders. I want to shine a light on your successes. I want to learn from what you have done, and I want to make sure that your experiences are available and shareable with other leaders. When it comes to building collaborations with faith leaders and community organizations so that we can change our attitudes towards both mental health and violence, I want to work with you as well, recognizing that many of you have spent years building strong relationships in your communities and that you understand how to best support and accelerate change in your neighborhoods. And when it comes to addressing prescription opiate abuse, this is something that we must work on together, not only to ensure that providers are prescribing judiciously, but also to help communities and local leaders understand the importance of making evidence-based treatments available and accessible to people. And I'm sorry to say that in too many places still in America, there are misperceptions and old notions about methadone, about buprenorphine, that are making local officials reluctant to put treatment programs in place. And as a result, we have many people who need treatment who simply cannot access it. All of these challenges that I've described, these are big challenges. They will take a lot of effort to resolve. Some of them will take a lot of time to resolve as well. But one thing that I want to be very clear on is that these challenges are not greater than the total sum of our power. And that's important to remember, because despite all the challenges that I have seen as a physician, as a patient advocate, and a Surgeon General, I have never been more hopeful that we can meet these challenges than when I travel around the country and hear directly from community members and from leaders on the ground. I know that when we put our mind to overcoming big problems, that history tells us that we will succeed. When I think back to the 1950s and 60s, few people at that time thought that our country had a chance of putting a man on the moon. But we pulled together some of the brightest minds in America and our will as a nation, and we made that happen. 75 years ago, there were few people who believed that we would be able to pass sweeping laws that would safeguard and enshrine the civil rights of minority communities across this country. But we proved that even in the face of violent opposition, that we could succeed when we stood by our highest principles, by our highest values, and by each other, and we did. 20 years ago, not too long ago, few people thought that universal health care was a possibility in America. But yet, as we stand and sit here today, after years of strife and struggle, we have Medicare, Medicaid, CHIP, and the ACA, which give nearly every American a shot at health care coverage. I look at these examples and I think this is what we can do when we put our minds and our hearts behind a cause. This is and has always been the true source of America's power. And that's why in 2015, today, as we face extraordinary challenges related to chronic disease which threaten our health, which threaten our economy, and which even threaten our military readiness, we are called upon to build a culture of prevention in America. So let us answer that call. Let us rise together as we have done for 239 years as a country and make America a model of health and strength and an inspiration for the entire world. As your Surgeon General, I thank you for your dedication and for your partnership. And I tell you that I am truly looking forward to all the great things that we will do together. Thank you so much.